Good morning and welcome to our Facebook Live. First one we're doing since we started the coronavirus. We're all trying to stay safe, washing hands. I've got a mask on. I'm going to actually take my mask off because I'm not within 6 feet of anybody, and it'll make it a little bit easier to talk. But the key, of course, is staying safe during this whole thing. And it's April the 14th. We're starting to see some evidence that the social distancing that we're doing as a nation is actually paying off, that the curve is flattening and certainly better than it would have been. But I just wanted to, acknowledge just what a stressful time this is. I know I've been feeling an awful lot of stress just with the unknown, and I think everybody in the country is feeling it, and people are dealing with it in different ways. One of the scariest things in life is when you're against an unknown sort of stress. And here we are with this virus that, on the one hand, we see these incredibly scary images of doctors treating patients and patients getting sick and huge numbers of people getting the virus and dying from the virus, and even healthcare workers, getting sick. This is, potentially so lethal. I've never seen a situation in my practice of medicine career where doctors and nurses actually got sick from treating the patients. So it's scary. And one of the scariest things for us, and for me personally, is what do we do with our practice? We're in the business of helping people to get off drugs and alcohol and get into long-term recovery and stay in recovery. And, those problems don't go away just because of the virus. And so we've had to deal with the question of whether we stay open for business, whether we try to help people or not, or whether we just try to protect our staff. And as a company, we've wrestled with this a lot, and we've decided that it is important that we continue to help people get off drugs and alcohol and stay in recovery as best we can. But we're trying to do it as incredibly safely as possible. So we're screening everybody that does actually come into the office. First, we're having people stay at home as much as possible. So my wife, Joan, is doing all of her telemedicine, family practice, and addiction visits from home today. And we're doing probably 98% of all of our visits remotely on the telephone. So we're not exposing our patients to have to come into the office and leave their house and not expose ourselves. And then when people do have to actually come in, we're making sure that we screen them first to make sure they haven't had any kind of symptoms that would be worrying, and they haven't been around people where they're highly exposed. And then when they come to the office, we're having them wash their hands and put on a mask. That seems to be the two things that are by far the most powerful. That if the person wears a mask, you're not so much protecting yourself, but you're protecting everybody around you. So it's an act of love almost to wear a mask and protect the people around you, because you may be asymptomatic carrier and may be passing on the virus without even knowing it. So if everybody does that, then we cut down on transmission. And then there's just so much evidence that touching your face, with your hands or your eyes is one of the most powerful ways of actually getting it. So washing your hands frequently after you've touched anything outside of your bubble. So we're trying to be safe, and then, we're treating the patients that need to come in. So if people need to come in for an naltrexone implant, we're doing it, but we're, just having as much distance as we possibly can, except for the actual putting in of the implant. Same with the Vivitrol shots when people get their monthly naltrexone shot. Detox. Have patients come into the office so that we can effectively educate them about the process and how to make it safe and comfortable. And we're still able to help people. We've got a guy coming in this afternoon who needs to get off methadone because it's just not working for him anymore. And we don't want him to go back to using street drugs, especially with all the fentanyl that's out there. We're still hearing horrible numbers of people dying from fentanyl overdoses. We've got an alcohol patient starting today. So, it's just like, what are you going to do? Tell her you've got to keep drinking and hurting yourself and your liver and everybody around you? No, we want to be able to help people, but we need to do it safe. So that's how we've sort of dealing with this. Everybody's having to make their own decisions too about how they social distance and how they stay safe. And I think as a nation, things are really moving along in terms of, I think it's taken a while, for people to really get it that this is a powerful thing and that we need to do it. We need to, do our part in social distancing. But I sense a change over the last 2 or 3 weeks that people are really much more on board. Everywhere you go now, people are staying away from everybody and keeping that social distance and wearing their masks and only going out as much as they absolutely need to. So if we get lucky, the curve will flatten and numbers will start really going down. If we get super lucky, doctors and smart scientists who are going crazy trying to figure out, medical treatments that can work for this thing. With any luck, we'll have a treatment that actually is successful. I was reading something about a drug that Gilead Science is working on, and there's some evidence that blocking the interleukin cytokine system in the body can be very dramatic in terms of actually saving people's lives if they do get it. If we get lucky and we get a good treatment for this, then this whole virus becomes a nuisance rather than a major catastrophe. If we've got a 95% success rate of saving people who do get it, then, it becomes more of a nuisance and we can go back to life somewhat as normal. And hopefully we've learned our lessons about being more prepared and having systems that can keep us out of the next crisis, whenever that is. So anyway, stay safe and take care of yourself and your family. And we'll hopefully have another video soon.